Right, so hello everyone, and welcome to one of ChildLine's life lesson videos. My name is Aaron George, one of ChildLine's outreach officers, and today we are doing this video to raise awareness about mental health. And the reason this topic was chosen was because on October the 10th, which is this Saturday, we will be celebrating World Mental Health Day. So, what better topic to do than raising awareness on mental health and some of the myths surrounding mental health and the challenges that persons with a mental illness may face? So, first things first, we want to offer a definition of mental health. What is mental health? Because we may hear this term floating around quite often. Mental health is essentially a state of well being. It's about where persons realize that they have the ability to accomplish certain tasks, they can work productively, they can be a contributing member of society, and it's not just about the absence of a mental illness. Yeah, because there are persons out there who may be experiencing a mental illness. However, it is manageable and is treatable in some cases, and the person is able to continue living their lives as normal, you know? So, that's more or less mental health in a nutshell. And there's a famous saying that goes, there's no health without mental health. So it's very important to keep that in mind. Your body could be perfect. You could have best heart rate, your blood pressure is on point, your sugar on point. But if mentally you're not in the right place, then essentially you're not going to be able to carry out the task and accomplish the objectives that you set for yourself for the day. Yeah. So, five key points that I want to raise about mental health. Thing number one, it is far more common than people actually think. There are many people suffering with some form of mental illness and dealing with it, coping with it silently in some regards. And it is important for us to be sensitized to the fact that this is the reality and this is the world that we live in, that there are persons walking around who they have clouds of darkness over them. They have challenges that they're experiencing. However, it doesn't mean that they're not able to live a fulfilling life. So that's thing number one. Thing number two, which I mentioned a little earlier, it is preventable and it is also treatable. Number three being it is more than just the absence of mental illness. Number four, it is an integral part of your overall life. And number five, a number of socioeconomic, environmental, biological, and psychological factors will impact your mental health. Yes? So keeping in mind that mental health is central to our collective and our individual ability as humans to think, to express our emotions, to interact with each other, to earn a living, and to enjoy life. And on that basis, the promotion, the protection, and the restoration of mental health can be regarded as a vital concern of individuals, and not just at that level, but communities and societies throughout the world. Yes? So, I want to tackle just a couple myths associated with mental health. And the first myth is that people with mental illnesses will not get better. That is not true. People diagnosed with a mental illness can lead a very productive and fulfilling life, especially if they are receiving treatment or if they are exposed to counseling services or even community support groups. Although some mental illnesses are more challenging to deal with than others, they can be effectively managed. So it's not a matter of you've been written off out of society's books. So, a second myth that I want to address, people should feel ashamed about having a mental illness. No, that's false. You should not feel ashamed. There is nothing to be ashamed about. Although there can be fear and stigma surrounding mental illnesses, it is important to remember that this fear and stigma only stems from misinformation about the mental illness that the person may be dealing with. People sometimes make assumptions or judgments about others based on what they think they know rather than what is actually true. Stigma occurs when one feels ashamed, disgraced, or even rejected and it often accompanies situations where people feel uncomfortable and embarrassed. It is important to erase, generally speaking, the stigma that surrounds mental illness so that people will gain the confidence that they need to go and get help. There are so many people walking around, like I said, who are suffering from a mental illness, and and some people may say, I think might be depressed or I might have anxiety, but they won't go to a psychiatrist or to a psychologist because they are fearful of the stigma that's associated with it. Yeah. So there's nothing to be ashamed about. We are all humans, and it is very normal at one point and the other for you to experience a mental challenge. It is normal. Yes, because like I said before, it's more common than we actually think. Yes. Third thing, as a friend, you can't do anything for a person with mental difficulties. That is also not true. You can do a lot for a person, starting with how you act and how you speak. Try to create an environment that builds on people's strengths and promotes understanding. If you notice that someone you care about is struggling with a mental health issue, you can be supportive. There are things that you could do. You could listen non judgmentally. You can encourage them to seek support from family or friends or even professionals like doctors or counselors or helpline listeners. And if the person is open to getting help, you could contact the resources that are around them and probably just show them, be there with them, go with them. There are things that you can do. You may not be the mental health practitioner to be able to administer the drugs that they may need or to conduct the assessments, but what you can do is give them that support and show them that it is in fact possible to live a happy life, have friends, have family who love you and care about you. Yes? So, and the final one is that mental illnesses are a consequence of a weakness in character. That is not true at all, at all, at all. Mental illness is not a result of personal weakness. Instead, mental illnesses, they're caused by a combination of biological, which would be your family history of mental illnesses, psychological, being severe or prolonged stress or even abuse that you may have experienced. It could be environmentally provoked, so maybe some sort of head trauma you experience or challenge during birth, and it could also be social. So you experience the loss of a loved one, or because of COVID-19, your family is your parents are not employed. All of these factors can make a person develop a mental illness. It has absolutely nothing to do with a weakness in character. And as a matter of fact, you know what? I'll do five. I'll do one more. I'll do one more. And this one is a big one. People with mental illnesses are violent and unpredictable. That is not true either. The vast majority of people with mental health conditions are no more violent than anyone else. Actually, if we're being honest about it, people with mental illnesses, they are much more likely to be the victim of a crime rather than the perpetrator of a crime. You probably know someone who has a mental illness and you don't even know it. So keep in mind that mental illness, it's a thing that can affect any one of us at any point in time. And there are a number of things that could cause it. Like I said, rapid social change, stressful working conditions, gender discrimination, being excluded from in social settings, violence, unhealthy lifestyle, physical ill health, limited financial resources, if you have violations to human rights or biological risk factors. There are a number of things that impact mental health. So, this is just one step in the direction of raising awareness about it. There are a number of agencies, places that you could receive support, and always keep in mind that ChildLine is there. If at any point in time you feel uncomfortable, you feel like you want to talk to someone about the issues that you're experiencing, just to get a perspective or a sounding board, feel free to reach out to the helpline 800-4321. It is free to call. You can call anytime, 24/7. It's available. And please always keep in mind that there's no health without mental health. So treat yourself kind, treat others kind, and do have a wonderful day. Thanks for watching. Take care.